Hi, I'm Dr. Bryan Baker. I'm a chiropractor, and I'm the founder of the Spine, Hand, and Foot Clinic on 39th Street near Nolan Road in Independence. We've been talking about low back pain, and I want to continue that today. We've been kind of working our way back from the symptom, the effect, which is what usually brings people into the office. It's what you're aware of when you have low back problems. And we've been working our way back trying to locate the cause. And that's an important thing to most people, although traditional treatment of low back pain with medication really serves primarily just to eliminate the symptom or the pain. And sometimes that's sufficient depending on what's going on to cause it. But most people come to us after that has not provided long-term relief. And so we're really searching to determine what is the cause of the pain. And we discovered that the only thing that really can cause pain is if nerve receptors that receive information and stimulate the brain to feel pain, because pain is actually felt up there. It's not felt down here, even though it seems like it to us. Pain is felt up here only when pain receptors, or primarily when pain receptors are stimulated. So there's two types of pain receptors that we identified. Chemical receptors, which mainly are stimulated by inflammation in the area. And we talked about those on the last video, so if you didn't listen to that, go back and listen to video number 3 in this series. And the other is mechanical receptors, and that can be there along with chemical receptor stimulation or inflammation, or it could be there without chemical stimulation. So if you take an anti-inflammatory and it makes the pain go away, you can pretty well bet there was some chemical irritation. If you take an anti-inflammatory and the pain doesn't go away, you can pretty well bet there's a chemical irritation without a mechanical irritation without a chemical involvement or no inflammation at the time. That's kind of rare, so usually you get some relief from anti-inflammatories, even if there is a mechanical component. You just don't get long-term changes. So what kind of mechanical stimulation are we talking about? Well, it's mainly stretching or compressing. There's a lot of tissues in your low back, all in a very, very condensed small area. You have many, many bones, you have ligaments, you have muscles, you have vessels like blood vessels, you have nerves, and any of those tissues and all of those tissues have mechanical pain receptors and chemical pain receptors. So anything that inappropriately stretches or compresses anything in that area can cause the stimulation of pain.